In this tutorial, we are going to talk about a super common question that I often get from people. Why is my hip popping when I do a leg lift? Now by leg lift, I'm talking about when you're doing, let's say like abs or something on your back and you lift your leg up, or maybe you do one of these. It could also apply to just tapping the toes down. But you know what I'm talking about. It doesn't necessarily hurt, but it's like a little click here in the hip. So let's talk about what's going on, why is it clicking, and what you can do to try to strengthen it or to try to help that click go away. If you are experiencing pain associated with the hip pop, this is a sign that you need to seek out a doctor and figure out exactly what's going on in the body, because that pain could be a sign that there's something more severe going on. However, for most people, the click in the hip doesn't really cause any pain. It's just really annoying, right? So what's going on when you get that click is it's most likely a tendon that is basically sliding over what we call a bursa sac. A bursa sac is not a bad thing. Everyone has them. They exist within our joints. So you find them in your hips and your knees and your ankles. They're like little jelly-like sacs that are basically almost like a pillow is a good analogy, that help to protect our joints. I'm sure you all have heard of bursitis, right? Bursitis is when that sac gets inflamed. So what's going on when we have this hip click is basically a tendon that's moving over that bursa sac, and then we hear the noise and we also feel it. Some things that can help is stability within our exercises, overall flexibility within the legs, and there's a third thing, limiting range of motion. So let's talk about those three things right now. The most common cause of the hip pop is stability. And based on what I just told you, I think this actually makes some sense. So imagine if you had like a band that was moving around gears, and every time it got to a certain spot, it kind of clicked and then it kept going. It would probably be because some other part of the mechanism was not stable, right? Some other piece is a little off track, which causes a click every single time you get to one certain spot. Well, the same thing applies to the body. So if I'm laying down on my back and I'm thinking about moving my right leg, so whether I'm doing this or I'm extending the leg, whatever it is, I want to check out the stability of the rest of the body. Because if all of these things are in place, it should ideally make it so that we have a smooth track for the leg to move on. So the very first thing you want to look at is your left side rib, okay? Left side rib creates this diagonal moving across the body to the right hip. So when you lift the leg, there's a good chance that the left side rib is trying to pick up off the floor, which is causing that tendon to slide over the bursa sac, and that's where you're getting the click. So number one, left side rib anchors down. Number two, right side hip anchors down. You're gonna wanna watch for the pelvis. So when you lift the leg, does the pelvis tend to shift or wobble? The more stable that you can keep the left side rib and the right side hip, the less likely you are to experience that click or pop. You also have to make sure that you set yourself up for success. So you have to ensure that you are in a position that you are actually able to stabilize. This is why alternatives are so important. So the least stable version of this move is what I'm doing right now. My head is not on the ground, my hands are lifted. I have nothing touching the ground except my stable points. If I wanted to make this exercise look more stable, I could bring this bottom foot to the floor. I felt it right there. This already helped me anchor my pelvis more. Another option would be to lay the head down on the ground or to place the hands down on the ground. Now, I call this technique shortening the lever. And I use this term pretty often. I won't talk about all the different ways you can use it now. But if this is me fully extended, right, shortening the lever may look something like this. I'm bringing everything a little closer to my body to help me stabilize. So another common reason that you may be getting that click in your hip is because you're really tight. In fact, one of the people that experiences that hip click the most are runners, because they're moving so often in this linear position along with impact, right? That it causes everything to tighten up. And the tighter it is, those tendons are not going to be able to smoothly move over the bursa sacs. So some stretches that you can do that are really gentle that will help you out are a good stretch for opening up the hips. I'm gonna take my ankle here, I'm gonna bring it across the chair, and then I'm gonna start to ease myself down as though I'm trying to get my knee to press down to the chair. You could also bring your upper body over, but this is really for people who are super, super tight in their hips. So as soon as you put your foot up on the chair, you're like, ouch, I feel it. Yeah, this one is for you. Another option that you can do, very, very similar stretch, is sitting down on the chair, prop your ankle up, and then flare the knee open, and you'll feel that stretch running right along the hip. Another place that you can do this same stretch is actually on the ground. So we do this often at the end of routines, right? Ankle is up to the knee and you're pushing open. Basically, it's this L position with the leg that you're trying to get, and that's gonna help you open up the hips. Another important stretch would be hamstrings. So once again, bring the heel up to the chair, see how far you can fold forward. And I always recommend, can you see my toe here? I always recommend trying it with both a flexed foot and a pointed toe. One of those will be easier for you than the other, so you'll know which one you need to spend more time in. To get a little bit more deeper in that stretch, try taking a towel or a yoga strap if you have one to stretch, and then down on the floor, bring the towel or strap around the ball of the foot, and then start to take that stretch here. Make sure that you keep your knee just a little bit soft so you'll get both hamstring and some of a hip stretch. And lastly, a really simple stretch for the quads would be simply to grab the foot behind you, then think about so see how I'm arched right now, okay? What you want to do is try to eliminate that arch and bring the knees closer together. So not necessarily like this, but instead like this. And you kind of drive the knee a little more forward and you'll feel that quad stretch there. And that's another good one to help you open up the legs. The good news about the Become Project is that almost every single sequence that we do incorporates an active stretch. So while you may not be sitting on the floor and just holding static stretches, we do what's called a lot of active and dynamic stretching, which is when the muscle is both active and lengthening at the same time. So a good example would be going from like a lunge and then coming up like this, right? Here, my leg is stretching, but I'm active in a position. It's one of the best ways to gain flexibility. So just know that if you are becoming, you are helping to open up those muscles already. The final point on this has to do with range of motion. So a really good rule of thumb is to stop before the pop. So when you're doing these things, you're focusing on stability. It's okay to not move your leg a lot. If you think about keeping your hips anchored and grounded, your ribs anchored and grounded, you're gonna be able to take really, really tiny motions like this and still feel your abs. Like right now, I'm feeling a ton of abs. Draw them in. Then you may be able to start moving into a slightly bigger range of motion without finding that hip click until eventually maybe the leg can go straight or maybe not, who knows. And then maybe you can level up by getting a little less stability on the ground. There's tons of different ways to do this, but overall, focus on staying super, super stable, keep the range of motion small, and incorporate hip opening, hamstring opening, quad stretches into your everyday life.